My name is Mr. Chitumba. There are certain things that we overlook in our life. There are certain things that we don't share when we come across in our lives. But there are simple things with simple explanations that when we discuss those things, they become very obvious to certain people and they remove the animosity or the anxiety that you can experience as an individual. So today, I am going to talk about female health. I'm going to talk about one of the common gynecological problems that women come across times and again. So, at one point or the other, women, they find that they are bleeding. They start to bleed outside the normal bleeding time of a normal period. And then they wonder, what is it that is going on with me? So, I am here to unravel the myth of vaginal bleeding outside the normal period. So, at one point, someone can feel that they are bleeding when they are not even pregnant. At another point, they might find that they are bleeding because they are pregnant. So, I am going to discuss some of the factors that causes bleeding in women, which is one of the going concern that most women come across. So, I am going to discuss, and then after the discussion, I need you to be assured that it's not only the worst case scenarios that can cause bleeding. Some of the things that can cause you to bleed are not as serious as what you might expect or what you might think. So let me talk about one factor that causes bleeding in a woman. So you might find yourself bleeding outside the normal period. That can be caused by masses that can develop inside your uterus, which are called fibroids. So when you develop these masses, which are called fibroids in your uterus, they can cause you to bleed. So when such type of a bleeding happen or take place to you, it might come with pain, it might not come with pain, depending on the nature of the fibroids, their locations, and the circumstance. So there are certain types of fibroids which are called pedunculated fibroid. So a pedunculated fibroid is a fibroid that attaches itself on the uterine wall, or it attaches inside the uterus, which you call the endometrial cavity. So when such happens, there is a challenge. When it twists, it can cause you to have pain or to experience pain. So fibroids that can also develop inside your uterus in a place what we call the endometrial cavity, where the fetus or the baby develops. That type of a fibroid is more prone to bleeding. It is more prone to bleeding because it is in the cavity, and the cavity communicates with your cervix. It also communicates with your vagina. So in such circumstance, you can find yourself bleeding. The good thing about it all is that a fibroid is non-cancerous in nature. It is non-cancerous by nature, meaning to say that if you have got a fibroid, it just needs management. So if these fibroids continue to grow big, they might pose a challenge in you, because they are going to occupy a space that the fetus is supposed to grow, and when that happens, it means they can compete for space, and then when you get pregnant, it can cause a miscarriage. So fibroids is one of the major culprits of bleeding that you might experience. You might experience the bleeding outside your normal period, or you can have excessive bleeding during the time that you are having your period. So you must be careful about that. Some people, they always think that when they are bleeding, it is because of cancer, which is not always the case. The other thing, or the second point, the second thing that can cause you to bleed is you might have a pregnancy. There are times during which females, they say that I am not pregnant because I am using contraception. So contraception is not 100% correct. It doesn't work 100%. So you might get pregnant with your Mirena in situ. Then you wonder why are you bleeding? So bleeding can be a symptom or a sign of miscarriage, whether you know that you are pregnant or you are not aware that you are pregnant. So you can still experience bleeding. The other factor that can cause one to bleed, when you develop a pregnancy, but that type of pregnancy fails. We have got different types of pregnancy that fail. We have what we call a molar pregnancy or a high density for more. What is a molar pregnancy? What is a high density for more? You can have a pregnancy, then only the placenta that is supposed to feed the baby develops, but the baby itself fails to develop. So it is the placenta that will grow. So when it keeps on growing, it will start to degenerate at one point. When it degenerates, what we call hydropic degeneration, it can now start to sort of shed off. Then you might also bleed. So bleeding can be as a sequel to a failed pregnancy that is shedding off, that we call a high density for more or a molar pregnancy. You can also have bleeding that takes place after you are pregnant, and then the baby and the placenta fail to develop, but the fluid that is supposed to accommodate the fetus develops. We call that an embryonic pregnancy or a blighted ovum. The fluid is there, but the baby and the placenta is not there. So again, that is a missed or a failed pregnancy. So it can also shed off. Then you experience that you are now having an episode of bleeding. Bleeding can take place due to what we call hormonal imbalance. So your system is regulated by hormones, estrogen and progesterone. So there has to be a balance at every cycle of your period. But when there's an imbalance, or if one hormone is produced in excess than the other, progesterone is produced in excess more than estrogen, or progesterone is less than the estrogen, that is what we call hormonal imbalance. Or when you're a female, you might experience an upsurge of the production of a hormone, the male hormone, which is called testosterone. So when testosterone grows in you, what it essentially means is causing an upsurge or a disturbance of the hormones that you're having. And then you can also have PV or vaginal bleeding. So hormonal imbalance is one of the major culprits in modern days that causes bleeding, because of the contraception, variable type of contraception that you're taking. Because they are hormonal in nature, some of these tablets that you're taking, they can also disturb your normal flora or hormonal flora in your body. And then you experience episodes of bleeding. So ideally, hormonal imbalance is one of the most challenging that you have. Why is it a challenge? It is because when you have got hormonal imbalance, if you go for other diagnostic measures like ultrasound, they see that your system is normal, the ovaries are normal, the uterus is normal, the cervix is normal, the vagina is normal. So you wonder what is it that is going on. So you have to take note that hormonal imbalance on its own can cause vaginal bleeding, and in that circumstance, there is need for a hormonal assay to see if it is hormonal imbalance, which hormone is in excess or which hormone is produced in lesser quantity, so that that can be corrected as well. The other thing that can cause you to bleed is a foreign body inside your womb. So in the event that maybe you have got a loop or an intrauterine contraceptive device that is you have inserted, if that contraceptive device is misplaced or displaced, it can pierce the walls of your uterus, it can pierce the walls of your cervix, and then you start to bleed. So you must also know the nature of the foreign bodies that you insert into your vagina, into your cervix, for instance. There are people by tradition who also use a certain type of traditional medicines, and then they insert those, so they can at one point cause you to bleed. The other thing that can cause you also to bleed is when you have got what are called polyps. Polyps are other masses also that can also develop inside your uterus, or they can develop in the cervical canal, which you call the endocervix. So how do you know that you have got polyps? You also need to have an ultrasound scan done on you, so that they know that you are having polyps that can also be causing you to be bleeding. There are also times during which you can have the so obvious and the most dreadful, which is cancer of the cervix, or cancer of the uterus itself, or the endometrium of the uterus. So cancer is another culprit that can cause one to bleed. So when a cancerous tumor or a cancerous lesion develop in you, it might cause you to bleed, because a cancer by nature, it needs more blood to supply the cells which are rapidly growing. So when that happens, it means you start to bleed, especially when you've got an intercourse and then the cervix is closer by. It can also cause you to start bleeding. So again, when you are pregnant, you might experience bleeding as a sequel to abruption or detachment of the placenta. So the placenta itself, it attaches on the wall of the uterus. There are times that during which it can detach. So when it detaches, it also causes you to bleed. Of which, when an abruption takes place, that's an emergency. That's a medical emergency. You have to quickly go to see your doctor, so that they see if the abruption is just marginal or is complete. Both the baby can die as soon as the placenta detaches. So when you experience such type of a bleeding, please, you have to go to see your doctor immediately, because the baby can die. The other thing that can also cause you to bleed is a coexistence of your pregnancy with another mass inside your uterus. You can have the mass, the fibroid that I was talking about. You can have polyps that I was talking about. You can also have other masses like what are called chorioangiomas, which are masses or lesions that can develop in the placenta. So when such happens, when the baby is growing, because of the pressure of the baby as it grows against the mass can also start to bleed. The other thing that can also cause you to bleed is when the cord itself detaches, or when this cord is squeezed out by the system, or it prolapses out. That can also cause you to bleed when there's a leakage of of fluid also in your body, what we call premature rupture of membranes, like the membranes that covers the baby, they can rupture, and then the fluid can come out at the same time. Because the mass is ruptured, bleeding can also take place. So you must understand the nature of the bleeding that is taking place in you. Where is it taking place? What has happened? You can also have got what is called traumatic bleeding. Traumatic bleeding is after someone, you are beaten by someone. Maybe you're pregnant, then they beat you, then there's going to be internal bleeding. So this is the other cause of bleeding as well. When you have got an extrauterine pregnancy that we call an ectopic pregnancy, it can also cause you to bleed, especially if it ruptures. So you can experience that you're now bleeding, and what is going on. It can also be due to the occurrence of what we call the ectopic pregnancies. There are times during which you can also develop atypical masses inside your ovary, or cysts inside your ovary, like what we call the polycystic ovarian syndrome, which you call the PCOS. So when you have got those multiple cysts inside your ovaries due to again hormonal imbalance or the overproduction of the hormone called testosterone, they can also lead you to bleeding. So when you bleed, you have to evaluate yourself. What happened? What has happened to me? At which stage of my cycle is it that is causing me to bleed? Am I on any type of a contraception, or I'm not? So you have to listen to your own type of bleeding. What is going on? There are also times during which you might not experience the bleeding itself. You're supposed to go for a period, then you don't, and you wonder what is going on. Again, that is a problem or a challenge that women can have. So what might cause that? When you have got an infection, the infection can cause the production of what we call burns inside the uterus. When those develop, they can, or the adhesions, they can close the cervical opening. When it closes the cervical opening, it means that all the menstrual blood is going to accumulate inside your uterus or your womb. It cannot pass out. So when such happened, you might not experience your normal period because it is all accumulating inside the uterus. So when it such happen, we call that a hematocarpose. So when hematocarpose take place, it means the blood is accumulating inside the cervix. But if it just accumulates inside the womb itself, we call that hematometria. So if that happens, you must go to have an ultrasound immediately done on you, so that you know exactly what is going on. The other thing, hormonal imbalance itself. You are producing a lot of testosterone. It causes an upset of the normal menstrual flow that you're supposed to have, and then you might also not see your period. There are times also during which you can have irregular menses, and then you wonder what is going on. So there's a time during which you are approaching your menopause. So when you reach 40 and above, for most women, they can reach menopause, like they stop their period forever. So around that area, or around that time, a lot of disturbance can take place. Like you can have frequent periods 2 times per month. Then it can stop, then come back again. So perimenopausal stage is one of the most confusing stage. So during my time as a practitioner, I've seen a lot of women, they come during that period. Times they can say that I'm bleeding 2 times per month, I'm bleeding 3 times per month. Or they can say I'm not experiencing my period, then it comes. Some other time it goes. You understand? So this is a challenge to do with your menstruation that is about to go away forever. Again, when you are post-menopausal, like you are 60 years and above, there is also a challenge that can occur when the uterus is shrinking. We call that atrophy. So there is what is called endometrial atrophy. So when the endometrium shrinks, it can also cause a challenge that you bleed. Endometrial atrophy can cause bleeding. So that is another culprit when you start to bleed. There is another condition again which can cause you to bleed, what we call adenomyosis. So essentially, what is adenomyosis? The uterus itself is made up of 3 layers. We have got the inner portion of the uterus. That inner portion of the uterus is called the endometrium. Then the other bigger portion of the uterus is called the myometrium. Then the outer layer of the uterus is called the perimetrium. So each layer of the uterus is distinct from the other. So there are times during which the muscles of the endometrium, they find their way into the myometrium. Like when you've got a cesarean section done on you, then you can have endometrial tissue going into the myometrium. So that one is called adenomyosis. So what happens is the endometrial tissue, because the inner layer of the endometrium, which we call the functional layer, is the one that actually thickens and sheds off during a period. So if it goes inside the myometrium, it keeps on thickening inside, then relax just like that. So it keeps on trying to undergo the normal menstrual period, and that episode now can cause problems again. Then you find yourself bleeding outside your normal times, or having irregular bleeding. So the gold standard is, do not make assumptions. Assumptions are very dangerous. So what you are supposed to do essentially is for you to seek medical advice, and then you can have an ultrasound done for you, and then they can actually know what is the problem. Is it adenomyosis? Is it fibroids which are taking place? Is it polyps? Is it that you are pregnant but unknowingly? Is it because the intrauterine contraceptive device that is new is displaced, that is causing you to bleed? So there's a range, there's a marriage of problems that can cause you to bleed. So you have to be abreast with this type of information, that what is causing my bleeding. Am I bleeding because of any one of the factors that I've discussed, or it's something else? So the onus is yours. When you feel that you're bleeding, make sure that you have a sonar done before you make assumption. Bleeding on its own can be life-threatening, because you might lose a lot of blood. You know that your brains and all, they require oxygen, and the circulation of nutrients also, it takes place in blood. So that can pose a big challenge. So make sure that bleeding is controlled at whatever stage during your period. I have summarized it all. What I have said is not all encompassing, but these are some of the factors that cause you to bleed during outside your period, normal period, or when you're pregnant. So these are some of the factors that you must have at your fingertips, so that you don't unnecessarily panic to say that maybe I am having cancer. Also, let us not run away from cancer, because the earlier it is detected, the merrier. It means we get managed earlier. If it means the uterus has to be removed, it gets removed earlier than for you to do it on the last minute. That is very dangerous. I thank you all for your time. I hope that we'll meet again in other presentations. Stay calm. If you've got any other suggestions, any other areas that we need us to discuss on, please feel free to comment below this video so that you can take care of whatever area that you feel that we have to discuss. Thank you so much.